We have all heard about coronavirus in the major cities of the world. We've been hearing about it in London, in Wuhan, in New York City.
This is undoubtedly a global challenge. At the same time, it's a very local challenge for us and a very personal challenge.
We are one people on one planet, and we're going to have to work together. And we can do it. Look at what we can do. My name is Dr. Kinnery Webb, and I am the founder of two nonprofits.
Rainforest communities are often forced to log the rainforest in order to pay for their healthcare.
And when I saw that situation, I just felt like this is just wrong. This is lose-lose, and this has to be solvable. They said, if we have access to high quality, affordable healthcare, and we have training in sustainable agriculture, we can stop logging. 10 years later, we had a 90% drop in logging households. We had a stabilization of the loss of the primary forest. At the same time, there was a 67% drop in infant mortality. Basically, the people around the forest were healthier, they were happier, they were wealthier, and the forest was better protected.
Not-for-profits and local organisations are so important because they're there. For number one, they exist in the community. So they have that very real connectivity and immediacy to respond to both needs and support. When we founded Australia for UNHCR, it was very much to meet what we saw a real need to connect ordinary Australians to the greater cause of UNHCR supporting and protecting refugees. We're already dealing with large-scale movements of populations providing for their basic needs, and now you have this added complication of preparation for COVID-19.
It became clear to me right away that this was going to change everything. So we went to the local government. We started having, what's your plan? And they're like, what do you mean, what's our plan? Like, we don't even have any cases in Indonesia. I'm like, you will. What's your plan? Right? And sure enough, the next hour, they had their first cases in Indonesia. We had to panic prepare our team to be able to expand services in case we had a flood of patients and to get enough protective gear for them. I mean, it was ridiculous.
Indonesia is a huge country. We have 17,000 islands with 8,000 inhabited islands. So we are under partial lockdown right now. We call it large-scale social distancing. Schools are closed and most offices are closed. There is some stigma around coronavirus and the patients, and we are trying to educate the people and that this is not anyone's fault. No one wants to get infected, and even for healthcare workers, they give their lives for others.
We're facing an emergency on an emergency. There's always a huge gap in what refugees will need and what the resources are there to meet those needs. But at the end of the day, in a situation like this, it really is going to be up to the individuals who are going to have to take the necessary measures to protect and keep safe themselves and their families. Our job as a not-for-profit is to give them the necessary resources to enable them to do that.
So in some ways, it feels like this enormous pivot because suddenly we're scrambling to learn how to deal with the pandemic, and we're having to do all this protective gear, and we're having to train our team, and or we focus a lot more resources there. But on the other hand, it's not that big a pivot, because what we do is human health and environmental health, and that intersection between the rainforest's well-being and human well-being. So we're just really expanding both of them.
The coronavirus reminds us, like everyone in the world, that we are connected and we have to work together to get through this.
At this time, I take a lot of lessons from refugees that I've met, you know, having to overcome challenges, which has happened to all of us here, because this time will pass, but there's going to be some really positive things that we can all take out of it. And refugees themselves will say that about their own lives also.
We are one people on one planet, and we're going to have to work together. And we can do it. Look at what we can do. If anyone ever thought that we are not capable of changing the trajectory of, human beings on this planet, I hope they have now realized that's not right. So we can do it.